All right, ladies and gentlemen, we are going to go over our second PowerPoint presentation for cultural diversity. So the United States uses a biomedical or Western system of medicine. Now, when you hear somebody talk about the Western system of medicine, it's based on the principles that we encourage patients to learn about their illness. We inform patients about terminal illness. Now, what did we say terminal was? Probably dying from that disease. The disease that we think of most of the time that's terminal is cancer. We also want to teach our patients about self-care, using medications and technology to cure or treat our patients' diseases. And we want to teach our patients about preventive care. We would much rather prevent a disease than treat a disease. A prime example of that, guys, is vaccinations. Okay, I would much rather prevent the disease by administering a vaccine for polio to you than to try to treat polio. Now, beliefs vary greatly among different cultures. Medical beliefs do, although not all individuals in a culture believe and follow all the customs of that group. Remember that, okay? Everybody is not exactly the same. We have a general sense of saneness, but not everybody believes everything in their culture, okay? So in the United States, we have an increasing use of alternative therapies. By alternative therapies, I'm talking about chiropractic, I'm talking about acupuncture, cupping, so massage therapy. There's lots of different people that are using alternative therapies now. And that is a test question. Alternative therapies are increasing in the United States. Individuals have a right to choose their method of health care. So we may want them to have radiation and chemotherapy for their lung cancer. But if they choose not to do that and choose a more holistic approach to that, then that's their right. They have a right to choose what treatment options they would like to follow through with. So beliefs in certain cultures, we're going to go over a few of them. So South African cultures, and again, this is the majority or a large population of people in this culture. It's not every single person in this culture. So South African cultures typically believe in maintaining harmony of your body, your mind, and your spirit. They believe that the causes of our illness are spirits, demons, or punishment from gods. They believe to treat patients, we should pray for them or have religious rituals to treat their diseases. Asian cultures, they believe that health is a balance of yin and yang. For their treatments, they use lots of herbal remedies. They use acupuncture, which we said was increasing in the United States as well. They believe pain must be endured silently, meaning you're not rolling around in the floor screaming, "Oh my gosh, I'm hurting so bad from this kidney stone. Give me some pain medicine." They don't believe in that. If they're hurting, you most likely will not know it because they feel as though their pain has got to be suffered silently. Okay? They keep it to themselves. Europeans, illness is caused by outside sources. Treatment with medication, surgery, diet, and exercise. That's exactly what we believe in our country. Hispanic usually believe that health is a reward from God and it's a sign of good luck. They also believe in heat and cold remedies. If you're feeling sick, most of the time Mom's going to give you something warm, some soup or some warm tea, something warm to drink, okay? So they do believe in heat and cold therapies or remedies. Middle Eastern cultures believe that health is spiritual and cleanliness is essential. And we all should believe that cleanliness is essential, guys. So the males dominate and make decisions on health care in that culture. They believe in spiritual causes of illness. They believe in the evil eye. And I do know a lot of Hispanic families have talked to me about the evil eye and being concerned that new babies that are maybe looked at differently or something, that there's some type of evil eye that can harm their baby. Okay? Native Americans, they believe that health is in harmony with nature, or it should be in harmony with nature. They believe that illnesses are caused by supernatural forces and evil spirits. They have the healer in their groups called the medicine man. And tolerance of pain signifies strength and power. This is also like the Asians. They believe that pain's got to be endured silently, and it shows your strength or your power when you tolerate that pain. Okay? Now, spiritual beliefs. We have different things that we need to know, and because you're going to deal with a lot of different types of patients. So we're going to go over the definitions of spirituality, religion, atheist, and agnostic. So spirituality just means that I believe that I have a connection with others, that I have a relationship with a higher power. It's beliefs that I have within me and my connections with other people or a higher power. That's spirituality. Now, religion is an organized system of belief in a superhuman power or higher power. And that's the difference. The spirituality is just what I have inside of me, okay? Just how I feel about things. So religion is actually the organized system of belief, like going to church. What denomination of church do you belong to? So that's that organized system of belief. We all in that little group, whether it's Baptist, Pentecostal, holiness, whatever it is, you believe in that organized system of belief, okay? Now, an atheist is someone who does not believe in any type of a deity, meaning a deity is like a divine status, a creator, a supreme being. So the atheist is someone that says, nope, there's no higher power. There's no other divine status or creator. There's nothing, okay? That's what the atheist is. They do not believe in any kind of higher power. Someone that's agnostic believes that the existence of God cannot be proved or disproved. So they're kind of sitting on that fence. They're not going to say he doesn't exist, but they're not going to say he does exist either. So they can't really decide if there is one or not one. They're not going to go either way. Okay, so they don't believe that it can be proved or disproved. So, as a healthcare provider, you've got to talk with your patients. You've got to determine what your patient's spiritual needs are. And the only way you can do that is by talking with your patients. Okay? You don't have to understand everything, don't have to agree with everything, but you've got to be sensitive to patients and what their needs are spiritually. You need to show respect for a patient's spiritual beliefs and practices. As I said, you ain't got to believe it, but you got to respect it, okay? So you want to be a willing listener. Let your patient talk to you. Support your patient's spiritual and religious practices. Like I said, don't have to agree with them, but you need to support them and respect them. Respect their symbols, their books. Allow privacy during clergy visits. And that, guys, is for any religion. If there's a preacher, a pastor, or whoever that's coming to visit that patient, allow them privacy, because sometimes there are things that your patient will want to talk about that they're not going to talk with anyone except that pastor or that clergy. So no matter what religion they are, if someone from the clergy, pastor, preacher, whatever, comes to visit them, allow privacy during those visits, and refrain from imposing your beliefs on your patient. Now, does that mean that you can't witness to your patient if they don't have a belief? No, it doesn't. You can witness to that patient if you feel led to do that. But if they let you know that they're not interested, then that needs to be the end of that conversation. You can't push your views on religion onto your patients, okay? But I do believe as Christians, if you are a Christian, that you do have an obligation to witness if that opportunity comes available, okay? And that's it for this PowerPoint.